Hi, I'm Gregg Silverman from the NYU School of Medicine, and I'm here at ACR 2017. I'm excited about my plenary session tomorrow, Monday, at about 11:30, where we're going to discuss our work in the microbiome and systemic lupus erythematosus. It was a lot of work, hard to recruit that many patients. We studied at a genetic level all the diversity of different bacteria that live in the intestines of lupus patients. We've all been hearing about how the microbiome molds all immune responses. We wouldn't have an immune system if it weren't for the fact that we're colonized. And what we discovered is that many lupus patients have remarkable distortions, dysbioses as the phrase go, amongst the complicated communities that they have in their intestines. The take-home lesson is people that had no disease activity at the time of visit, they had a diagnosis but sleet eyes of 0 to 2, they look like normal people with a normal distribution of bacteria. But in fact, in general, as you became more ill, your sleet eye score got higher, you had more and more abnormalities, and you had an expansion of a single bacteria in the intestine, an obligate anaerobe called Ruminococcus novis. It actually is otherwise pretty benign. It's a keystone species, everybody has it, but in fact, as you get sicker in lupus, there seems to be more and more abundance, but even more importantly, what we found is there is a direct relationship in the levels of an IgG antibody in the bloodstream. The more of this bacteria you have, the more of that antibody response. Why is that important? Because it cross-reacts with DNA. And the whole idea is we think that certain strains of this bacteria drive IgG anti-DNA production, and this actually seems to only occur if you have active lupus nephritis. We know anti-DNA is a major driver. We always thought it was mammalian DNA that's driving it. Now we think it's an immune mimic, a glycan in one strain of Ruminococcus novis. This may all sound very complex, but it's just a bacterial response, an antibacterial response, and this is just part of a really well-known syndrome. We've learned about it a long time ago. We learned about it in second-year medical school. This may just be a variant, just like post-streptococcal glomerulonephritis, just like post-streptococcal rheumatic fever. Now it appears that a first cousin of streptococci, a different kind of streptococcal-like strain, Ruminococcus, is inducing the antibodies that get deposited in immune complexes in your kidneys. This is great news for lupus patients because we may have a more accurate test. We may understand why people transition from genetic susceptibility to overt disease, and not only early detection management, how bad is your response, but this may suggest therapies where we can actively modulate the microbiome, perhaps with antibiotics, more likely just some prebiotics. So a lot of opportunities, so come and join me and learn more about it at the program tomorrow at 11:30. I'm Gregg Silverman from ACR 2017. You have a great day.